Tonight on Headline Humboldt, we examine California's attempts at addressing prison overpopulation and criminal justice reform by analyzing how some of these changes have impacted local jails up and down the state. Has progress been made, or has the state simply pushed the problem off onto county government? Also this week, two outstanding murder investigations have finally resulted in arrests, with both suspects in the unrelated killings found to already be in custody. Coming up next. Live from the top of Humboldt Hill, this is Headline Humboldt. I'm James Falk. Thanks for joining us. About a decade ago, I famously lost several years to a heroin addiction. It derailed my family, my career, made me homeless, and ultimately ended me up in jail. At least it was some kind of a home, right? There's nothing quite like the experience of being stripped naked, then shoehorned into brightly colored clothes that don't fit and rub coarsely against your skin. The stench, meanwhile, of bleach and sweat makes your eyes water and your throat itch. We can and later will debate whether addicts need to be in jail or in rehab, but the short incarceration did offer me a chance to stop, and that break from dependency probably saved my life. Into the Humboldt County Jail, I took with me a decade of experience as a reporter and editor. I'd covered many arrests, many suspects, and told their story, mostly from the boldly printed and one-sided narrative supplied by police. Up until that moment, the people in jail had always been abstractions. They'd done something wrong and deserved punishment. Such a simple equation, however, is almost always wrong. With my own arrival in what inmates glibly called the pink house because it's pink, I suddenly and irrevocably realized that all the accused criminals I'd covered over the years didn't simply vanish after sentencing to sit out their allocated punishment in a neverland of justifiable misery. They never ceased to exist, though we ceased to care. Most inmates are in fact perfectly redeemable. They've made mistakes and lived lives that to many of us would be unrecognizably savage and painful. But they also know right from wrong and would much rather learn to live within society's bounds than to continue to struggle without. But too often now, the mode of punishment we prescribe pushes these people further down the scale of criminality while doing virtually nothing to help struggling men and women earn their way back into our communities. This used to be a problem mostly in prisons, where a hardened culture of so-called respect and ferocity forced inmates to adapt or die. But given recent reforms, which we will discuss tonight with our guest Linda Stansberry, those pressures are now spreading to local jails as well. California prisons are overcrowded. AB 109, legislation passed in 2011, was meant to fix that situation. But as Linda will point out, its impact has been anything but beneficial to most inmates. I believe it even creates a likelihood that some minor offenders who otherwise might have served their sentences and learned their lessons will become more serious criminals. Here's a strange fact. Local jail is actually much worse than prison, so I've heard. The food is worse, the accommodations are less comfortable, there is no yard to run around in, and the opportunities afforded to inmates are fewer and farther in between. What had been a positive of staying in the county jail, a more relaxed and civilized culture among what you might call amateur inmates, is largely vanishing. Meanwhile, those prisoners who suffer the most seem to be nonviolent offenders with the likeliest shot at rehabilitation. Do we want to redeem these folks and welcome them back as constructive members of society, or do we just want revenge? Even worse, is jail simply meant to be a way of ridding society of inconveniences, like the mentally ill? I don't know. Now the interview. Hi, Linda. Thanks for joining us. Tonight we're discussing AB 109 and some of its impacts as they've gone downstream. Let's talk about that. What do you got?
Well, in April 2011, then California Governor Jerry Brown passed Assembly Bill 109, a policy intended to reduce the population of California state prisons. According to documents presented to the U.S. Supreme Court, in 2009, state prisons housed 160,000 people, roughly twice their intended capacity. This overcrowding resulted in inadequate mental and physical health care, with one report stating a prisoner died needlessly every 6 to 7 days. In May 2011, the Supreme Court ruled 5-4 that prisons must reduce their population by 30,000 people. AB 109 was one of several legislative changes that helped California meet this goal. The realignment bill shifted the responsibility to house and supervise people convicted of nonviolent, non-sexual, or non-serious offenses from state prisons to local jails and probation departments. But some critics say this has had major unintended consequences for those entities. So I sat down with 2 local law enforcement officers who reflected on the past 10 years of realignment and the impact it's had on their profession.
There was a lot of concerns about kind of realigning some of the state responsibilities on the county level and the impact that would have on our local jails and our local populations and the services that we offer. And, that was always a concern. And one of the things that the state mitigated those concerns was saying there's going to be money. There's going to be money for jail expansion. There's going to be money for programs. We're going to give both the sheriffs, probation, and mental health, as well as the city police departments, municipal police departments, money to kind of offset some of the issues that realigning some of the responsibilities to the county level. So a lot of people thought, well, okay, this could be a good thing for our county. If we're getting more revenue, we may take on more responsibility. But we had no idea actually the impact that AB 109 actually did have on just how we do business here in the county when it comes to public safety. So over the past decade, we've seen a huge difference in the impact on the county jail. So what's happened is the county jails have always been a place where we focus on rehabilitation. Historically, a county jail is basically set up to take care of those public nuisance type issues, the minor offenses that we can actually get people off of the streets, hold them accountable, and making sure that they pay their debts to society, and then also get something out of it. So we have program intensive. We also have a sheriff's work release program. And oftentimes I say it's like this is what we call the gift of jail. We give people the opportunity to get out of the environment they're in public, put them in a secure environment, so we can give them the tools they need to be successful when they get back out. And that may be rehabilitation. They may get their head clear on drugs, and get them stabilized in mental health treatment as well. All those things essentially have gone away with AB 109, because what we are doing now is we are housing serious and violent people here in custody that should be in state prison. And realistically, in the past, before AB 109, you got convicted of a felony, you were sentenced to over a year, you did that time in state prison. And then when you were paroled here back to our county, if you violated parole, you went back to state prison for a term. It could have been 6 months or a year. And our county jail was built 25 years ago. This wasn't built to have, state prison inmates, people that are here for longer than a year. We don't have the ability to have someone go outside and actually see the sun. They don't get to feel the sun the entire time that they're in our custody, unless they happen to be on a program that an inmate program that they're outside doing, roadside maintenance, one of our work crews. But we're built for a county jail, which means that people shouldn't spend longer than a year in our county jail. So that's the problem. Now we have benefited, a little bit from AB 109, because we got some of the prison realignment money. And so we've expanded some programs here locally with probation, as well as our sheriff's work, our alternative programs, and they're paying for jail medical and some of the other things. But we're seeing, because it's state money, it's taken us 5 years to get to the point where we may be ready to break ground next year. And nothing is easy. Nothing's easy. And so it's created a lot of issues within the county. And I wish we could go back 10 years ago and tell the Governor Brown, no, this is a terrible idea.
According to Sheriff Hansel, COVID-19 has exacerbated the trend of persons not serving time for some offenses, as the facility is currently running at under capacity due to the need to quarantine and socially distance inmates. The jail is also housing many people who have been found incompetent to stand trial, part of a troubling statewide trend. According to a recent report from the American Civil Liberties Union, the wait list for the California Department of State Hospitals has increased by 500% since 2013. Hansel told Keat TV that the Humboldt County Correctional Facility has 8 beds reserved for inmates who need mental health treatment, but between 25 and 30 people waiting for those beds. The state is supposed to initiate a treatment process within 28 days of a person being declared incompetent to stand trial, but Hansel says this is not happening. Instead, many people who need treatment are languishing indefinitely in our local jail. We also spoke with Chief Casey Day, who took the helm of the Fortuna Police Department in 2020 after a 19-year career in Anderson, California. Day described the initial passage of AB 109 as worrisome and disheartening.
Of inmates that were released as a result of AB 109 back into the communities were already repeat offenders. They were, in some instances, career criminals. And so I'm not necessarily certain that AB 109 was the causation for the behavior, but it definitely presented the opportunity for those that should have been locked up and being held accountable, the platform in which to continue to commit crime. And yes, we did see that firsthand. I can definitely see it being argued both ways, but at that time, I was actively working as a street cop, and yes, it definitely created the opportunity for repeat offending and recidivism. AB 109 was really just the start to, something that, I feel was a major swing by the state to go from tough on crime state to everybody deserves rehabilitation and we shouldn't hold anybody accountable, because that's essentially where we have morphed or evolved to. Evolved, it would be the opposite of evolved. So we've actually regressed. There was, the decriminalization was so significant that, the state of California stopped holding offenders accountable for their actions. So in Fortuna, what we see is the same thing that everybody else sees. We arrest somebody 10 times in 2 months. And because of decriminalization and the way things are in California now, they go to jail and they get released. That's not the sheriff's fault. It's not the DA's fault. It's not the police department's fault. But, it's how things are now. It's a revolving door effect where, if you commit a crime, most people know they're going to be released from jail pretty quickly.
Day recently met with Sheriff Hansel and District Attorney Maggie Fleming to discuss a project called the Chronic Offenders Accountability Program, or COAP. COAP would reserve a specific number of beds at the county jail for people frequently contacted by the Fortuna Police Department. This would be similar to a program implemented in Shasta County. The next steps include getting comments from local presiding judges. Day said this program wouldn't address all of the issues he perceives as having been created by AB 109, but it could give his officers another tool to address problems with repeat offenders in Fortuna. Day also echoed Hansel's call for better mental health treatment across the state.
Each agency was kind of responsible for identifying who the chronic offenders were in their community. So in Anderson, we would do that at the patrol level, and the detectives level would basically say, okay, these 3 people we're dealing with 90% of the time. They're repeat thieves. They're essentially every day of the week or every night of the week they were, stealing whatever wasn't bolted down. And so it was those 3 or 4 people at that one time that were they were drain on the department resources, because they're taking 90% of the beat officers' time and the detectives that are out there taking those reports and cases. We would identify them with the district attorney there as our COAP person. And so when we arrested them, they would go to jail and they would stay there and go through the court process. And so what we saw start to happen was that revolving door stop. We have to find a better way to approach and deal with, not just here in Humboldt. This is an American policing problem. And the reason it's a problem is because, you know, when I went through the police academy, even though we were trained on people with mental illness and, you know, kind of what to be aware of, that education and throughout my career has you know, tripled. We're more aware now of the proper ways to deal with mental health, or people that suffer from mental health issues, but we're not social workers. Law enforcement is not social workers. We don't have the time, we don't have the resources to dedicate to, you know, the overarching problem. And unfortunately, a lot of these communities throughout California, they elected 10, 12, 15 years ago to close their facilities and to reduce the budget of county mental health. And, you know, the Humboldt region, in my opinion, is even in a more precarious situation because, you know, maybe the qualified social workers or clinicians are not in abundance. You know, they're not living here, they're not working here. And so I don't have the answer to that. I think it's a complex problem with a complex answer, to be very, very candid. And I don't think that we're any closer today than we were yesterday to solving it.
Day ended our interview with a plea for voters to better understand their propositions. The California Institute of Public Policy released a study in 2015 that showed a rise in inmate assaults on jail staff after the passage of AB 109. All of this comes during what Hutson is calling a crisis in staffing levels for his agency, with almost 30 positions left unfilled.
Thank you so much for that reporting, Linda. That's fascinating and some in-depth information you brought us. So, I mean, basically, let's go back to ground level here. I mean, AB 109 was passed to solve a problem. Has that problem gotten any closer to being solved, or has it just sort of pushed it off onto a different, you know, recipient, I guess, or whatever?
Well, if the problem is the mental health and the physical health of people who were once in prison, what I'm understanding is that is still a problem. It's now the county's problem.
Yeah, and overpopulation. I mean, how is that? How is, are we still overpopulated, or where does that stand?
California state prisons have reached that benchmark that was established in 2011, the reduction of 30,000 inmates in state prisons. But that wasn't necessarily accomplished by AB 109. The major difference was made by Prop 47,
Prop 47, yeah.
Which was passed in 2014.
And describe that for us. What did that do, and how was it? Was that more effective, would you say?
Well, according to the research that I read, yes, it was more effective. That's for a couple of reasons. So Prop 47 changed the sentencing for many crimes that were previously felonies to misdemeanors.
Like petty theft, forgery, drug possession, that kind of thing?
Exactly. And so that applied not just to people who were entering the criminal justice system, you know, as first-time offenders perhaps, but it also applied to people who were in prison. So they had the option to retry their cases. I don't know if that's the right language, but that ended up meaning a lot of people were released from jail or prison.
You know, one of the major issues I think that we have, especially in Humboldt County, but also probably elsewhere across the state, is that oftentimes it's trauma that is, you know, putting people in the pipeline for prison, and they don't often get the services they need. Let's talk a little bit about that. How effective do you think the state is in dealing with trauma among kids, and what more do you think could be done?
Well, I mean, let's unpack that a little bit, okay? So historically, funding for primary prevention, so this is talking about people, young people, children, who are experiencing traumatic events, you know, what we've referred to as ACEs, adverse childhood experiences. So neglect, abuse, parents who are being abused, parents who are drug addicts, houselessness. So studies have shown that they're more vulnerable to a lot of different health problems. And oftentimes those can make them more vulnerable to entering the criminal justice system. So from what I've seen over the last 10 years as a reporter and as a member of this community, I have my own ACEs scorecard, I think all of us do, is that we've become a lot more trauma aware. There's a lot of promising research and promising programs locally to address that. But if you look at what you're seeing on the ground in our local communities, on the streets, literally, all of these changes, the criminal justice system, it's coming in the midst of a housing crisis. It's coming in the midst of an addiction crisis. Many people would say that we could do better.
Yeah, compounding problems and solutions just as hard to find as ever.
Absolutely.
Well, thank you very much, Linda, for bringing this to us, and we look forward to having you on the show again.
Thank you, James. I appreciate it.
Yeah, no problem. We'll be back after this short break.
Far to the north, there's a winter wonderland, famous the world over, where lights dance in a star-filled sky, where the sun shines in the middle of the night. Up here, the land is always changing, bringing drama and wonder. This is Lapland, a place so full of magic, it's even said to be the home of Santa Claus.
Artist, inventor, enigma, Leonardo da Vinci.
Leonardo embraced mystery.
Is science the key to his Mona Lisa?
This is the beating pulse underneath her skin.
There was a reason for every decision in every line.
He doesn't make a distinction between the arts and sciences.
Decoding Da Vinci on Nova.
Another week and more is yet learned about the surging Omicron variant of COVID-19 and how local officials are working to get ready. Key contributor Ryan Hutson has the story.
As COVID-19 continues to circulate through Humboldt County, community members are being hospitalized at a disconcerting pace, and holiday travelers are asked to report their positive home test results to public health. Addressing local reporters, Humboldt's health officer discussed misinformation and hospital rates as the county heads into the expected year-end surge.
If you ask any of the folks who've been in the hospital over the course of the last 2 years, many of you have reported on what the actual situation is like in the hospital. It's truly sad and heartbreaking what's going on. I think part of it is misunderstanding of how our healthcare system works. When we put out numbers daily and people don't see these big numbers, they see 1 or 2 hospitalizations each week. They don't understand that those people sit in the hospital for sometimes over 40 days. The average hospital stay for a COVID patient is 28 days, so that's nearly a whole month. That's a huge impact. So, if you're getting daily admissions to the hospital, that's what happened back in August and September, and we reached levels of 40 patients in the hospital across the county, and that was completely unsustainable. As far as how it relates to, flu deaths, we haven't had a single flu death throughout this whole pandemic. So I think, part of that is the precautions that we've had for COVID are, very effective against influenza, which is not spread as easily as COVID. COVID spreads easier than influenza, and COVID is much more deadly than influenza. So if you just think about, though, like the impact right now of the number of people we have in the hospital with COVID, today at 19, the other day, around 14, 15, it's been, like I've been saying, around 10 to 15 for several weeks now at a really high plateau. That would be a terrible flu year, like a really terrible flu year. And even to have, 100 deaths, we've never had 100 deaths from flu. I mean, that's a really high number. So if you follow the right numbers, you'll see that this is devastating. If you have any questions, talk to anyone who works in the hospital, because they are living through, literal hell right now.
Public Health is also monitoring travelers for the Omicron variant and asks residents who have traveled internationally in the last 2 weeks and tested positive with an at-home testing kit to please call the Joint Information Center at 707-441-5000. Ryan Hutson for Headline Humboldt.
A Eureka man has been charged for allegedly killing 32-year-old Lynn Foley. In June of this year, Foley was reported as a missing person under suspicious circumstances. She was last seen with her dog in Eureka this past April. Eureka police announced this week that Jason Miller, a 40-year-old Eureka man, is being charged for allegedly killing Foley. He was already in custody for unrelated charges. Her body has not been recovered. Police say the investigation is ongoing and that it's not too late to come forward with information on what happened to Kira or the whereabouts of her body. Anonymity is an option. An email and tip line have been set up to receive information regarding this investigation. You can send information to Kira Foley Tips, that's Kiera Foley Tips, at ci.eureka.ca.gov, or you can call the tip line at 832-5161. In a similar development, another man already in custody has been charged with the 5-year-old killing of 18-year-old Jennica Suazo. Roughly 5 years ago, Suazo was found deceased in her residence on the 300 block of P Street in Eureka. Eureka police reportedly interviewed dozens of people, analyzed evidence, and waited for DNA results. In May, EPD requested that the Humboldt County District Attorney's Office charge 34-year-old Anthony Lee Hamilton for Suazo's murder. He was charged for allegedly murdering Suazo this week. Hamilton has been in custody since 2017 on unrelated charges. That's all our time for this evening. I want to thank Linda Stansberry for coming in and giving us that story on prison reform and all the issues and complexities that go along with that. I'd like to refer viewers to our website. We have Addicts Among Us posted there, which is a documentary that involves a lot of those same issues, including addiction and in particular ACEs and childhood adverse experiences that can lead people into lives of criminality or drug abuse, addiction, that sort of thing. So I'd refer you to go to that and take a look. You can also go to headlinehumboldt.org and check out the show and other shows. And if you have any news tips, feel free to send them in to Keat TV. Thank you so much. Stay tuned, stay informed.
Far to the north, there's a winter wonderland, famous the world over, where lights dance in a star-filled sky, where the sun shines in the middle of the night. Up here, the land is always changing, bringing drama and wonder. This is Lapland, a place so full of magic, it's even said to be the home of Santa Claus.